basically what we're going to discuss today is talotarsal dislocation, and we see that right here on the x-ray. And basically the ankle bone is not sitting well with the other bones. All right, so we're going to put this here on paper. So if you look at the ankle bone looks something like this. And then the heel bone looks something like this. And then the other bone sits in front of it, and then the other bone, and then the big toe bone sits in front of that. So normally, if you look on x-ray, you should be able to see a hole right in this area that is constituted by the top bone and the bottom bone. So there's like a top cup and a bottom cup, and they come right against each other. And there's cartilage here and cartilage here. Cartilage. And they operate just like my hand right here, and they operate like this normally. Okay? The problem comes in is when the top bone slips and falls into the other bone. And as that slips and comes forward, not only does it come forward this way, sometimes it also goes sideways and it locks into it, and it becomes really severe. So as it sits here, this is where it should be. That's how we want it to be. But when it falls down and slips into it, then it becomes a problem for the patient. So on paper, what it's going to look like, it'll look something like this. Then the bone will sit this way, and then the other bone will sit in front of it, and the other bone will sit in front of it, and the toe would sit here, and then you have collapsed the sinus. So now the bone sits in a bad positioning. What we need to do is we need to move this upwards. Once we move it upwards, there's a ligament in here. And that ligament holds everything together. It's called interosseous ligament. There's also capsules and so on and so forth, and other ligaments as well. Here, we are not going to concern ourselves with those, but there is a ligament here in the middle. So we cut the ligament, and once we cut the ligament, we put the bones back where they should be. Once we do that, the ligament will be here. Then we'll introduce the stent right in between here, and the ligament will engage the stent. So the stent is actually in the ligament. It's not touching cartilage, it's not touching bone, it's touching ligament. So it's an interligamentous, extra-articular, because it's outside the cartilage, and extra-osseous. So it's an interligamentous, extra-articular, extra-osseous stenting. And that stent sits inside there, and it's a dynamic unit, because as it sits in here, it sits on a side angle just exactly like the sinus is. And as it does that, as this moves, this stent will move with it a tiny bit. And as it does that, then it is like a ball bearing device. And it keeps the talus, which is the ankle bone, this is the talus, in good positioning all the time as you walk. So that's what happens with it. Okay? And that's basically the rear foot correction.